All through my life, I know I've had a passion and an interest for science subjects, and I've always also had a desire to help people. So I think studying medicine in today's society, I hope to kind of help to balance out the disparities in healthcare, because access to healthcare is something that a lot of people in Australia and around the world are suffering with.
As a doctor, your role is to help each individual patient you come into contact with, and obviously, that ability to be able to help someone is hugely powerful.
When I was looking into the program details, there was such a variety of courses, and there were some electives that you could choose to kind of figure out what you wanted to go into.
In first year, you do a number of foundation courses which are shared with a lot of other health science subjects. So you definitely are exposed to a broad variety of students from lots of different disciplines, like exercise science, dentistry students, pharmacy students, lots of different people pursuing lots of different careers in the health scope.
And then followed on from that in second year with more advanced courses like metabolism, human anatomy, neuroscience, immunology, all of these really complex and exciting things that helped me to decide potentially what I want to go into in the future.
In the future, you do interact with each other and you all are working together to provide care to patients. So it's really good to see all the different perspectives.
Everything's more practical. So we actually have anatomy labs, we also have communication workshops where we kind of practice different scenarios which will be very helpful for the future when we become doctors. And also like clinical skills as well, like cardiovascular examinations, how to do injections.
In undergrad, we had a really good experience working in a biomedical laboratory. So we got to practice isolating DNA from bacteria, we got to run PCRs, we got to do gel electrophoresis, and we also got to look at isolating proteins, and then some more chemistry stuff with looking at spectrophotometry. So we got a really good grounding of what biochemistry kind of looks like, and it was great to get in there and learn hands-on skills.
Really modern, the facilities, in particular for anatomy. We get a lot of anatomy exposure here. There's a huge body donation program, as well as a museum upstairs that we can use to study anatomy. And of course where we are now, which is where we practice clinical skills, which is all set up to look like what the hospital wards look like.
So being a career, especially for the medicine and the Bachelor of Medical Science degree, was really like a family for me. Especially from an interstate student, I'm by myself. It was very nice to have other friends and always hang out together and stuff, so it was lots of fun.
So the Medical Student Society offers a broad range of activities we can do, from social barbecues and breakfasts, so we can get to meet people in other years. And then there's a range of academic activities, so we've got practice exams, practice anatomy labs, and then there's a lot of well-being activities, so promoting student mental health and stuff like that. So I think it offers you a great variety of different activities that you can do outside of your studies that really allow you to meet different people and kind of develop holistically and make sure that you get a good work-life balance. The subject that had the biggest impact on me was in our first semester of first year. We did a human biology subject, and that's the first time I'd ever learnt anything really about human anatomy or physiology. And I just found it fascinating to figure out how the lungs worked for the first time, figure out how the heart pumps, and it was such a great opportunity to have everything taught to you in one hit. And then we got to go into each little bit a bit deeper in our subsequent semesters throughout the degree. So I think that first subject really brought about the sense of all learning about the human body for the first time.
When I first came into medicine, I had no idea what sort of job I wanted to do, because everything's super interesting to me. There's so many different things to learn. I kind of want to get involved with everything. So I'm hoping, especially through years 3 and 4 in medicine, when we do our clinical rotations, I might have a better idea of what I want to go into. I know I really like looking after people and having that patient interaction. So hopefully some sort of profession where I can see patients in my day-to-day life and help them improve their quality of life.